There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, how can high blood pressure make you sleepy? Answer by Angela Punis. A natural benefit, omega-3 fatty acids are also thought to be natural fatigue fighters. One 2015 study shows that metabolism increased while resting and exercise heart rate dropped in older women who took omega-3 supplements that contain 2 grams EPA, 1 gram DHA for 12 weeks. However, whether omega-3 actually improves resting metabolism and exercise heart rate remains unclear because there are many conflicting studies. Video here. Blood pressure exercises vs LCB. Why they're prescribed. Statins and fibrates are used to treat high cholesterol. The top-selling statins are atorvastatin, Lipitor, rosuvastatin, Crestor, and simvastatin. Zocor. The top-selling fibrate is fenofibrate. Tricor. Muscle weakness and severe muscle aches throughout the body can be symptoms of statin-induced rhabdomyolysis, a rapid breakdown of skeletal muscle that causes muscle fibers to be released into the bloodstream. A substance called myoglobin within the muscle cells that is released can result in severe kidney damage and even kidney failure. Why they're prescribed. Proton pump inhibitors are used to treat gastroesophageal reflux disease, GERD, and other similar disorders. More than 20 million Americans take prescription PPIs, including esomeprazole, Nexium, lansoprazole, Prevacid, omeprazole, Prilosec, and pantoprazole, Protonix, some of which are available over the counter. How they can cause fatigue. Patients who take PPIs for as little as 3 months are at risk of low blood levels of magnesium, which can cause loss of appetite, fatigue and weakness, among other symptoms. It's important to remember that it takes older people up to 3 times longer than younger people to flush these drugs out of their bodies. The ensuing buildup of the drug in the body puts older people at a much higher risk for experiencing fatigue and for developing physical or psychological dependence. For all the conditions listed above, there are alternative drugs and non-drug treatments. Melatonin, in doses from 3 to 10 milligrams before bedtime, for instance, sometimes helps to re-establish healthy sleep patterns. Older people generally should not use diphenhydramine, Benadryl, found in any sleep aid with the name ending in PM because of its powerful sedative effects, which dramatically increase the risk of falls and bone fractures. Fatigue is also a listed side effect of fexofenadine, Allegra, another popular antihistamine, though perhaps less than other such drugs. Older people generally should not use this drug because their renal systems are unable to efficiently clear it, allowing the drug to build up in the body. How they can cause fatigue. Antipsychotics are drugs that dull the activity of the central nervous system. In studies, the side effects include fatigue, lethargy and weakness. Many of these drugs also lower dopamine levels, which can lead to drowsiness and sleepiness as well. Answer by John Ruth. If you're sleepy due to high blood pressure, then you better pray you are in hospital or going, as this would suggest an imminent catastrophic cerebral emergency.